I'm Malcolm Newbury of Guildfoss, business development company for open source SMEs and university projects. So what we're here today at EHI Live 2012 at the Skunkworks stand. This is the second year that we've been in operation. We're an island of open source companies. Our business models depend on the open source model amongst a sea of proprietary vendors who've dominated healthcare for 20 years or more. But we're making a difference. You know, people are listening to us. People are increasingly interested in our new approach to developing and rolling out software. It's not based on engineering. It's not based on science. Those approaches have failed for software. In healthcare, we're dealing with very intelligent users. You know, they're clinicians. They've spent 7 years studying. They know what they're talking about. And when you get them together with developers, as we do in Skunkworks and at hackdays, then we get magic to happen. And it's not just Guildfoss is doing this, it's other companies as well. But it's a different approach to developing software. We'll focus more on the art that's created and the impact that it has before we get into the engineering aspects, like SLAs for reliability, availability, and all the other abilities which tend to get us into trouble and tend to get us looking at systems integrator companies rather than small SMEs that you have on this stand. So we're really pleased to be here. We're extremely excited by this event. This is the biggest healthcare IT event in the UK. It's getting bigger and bigger every year. The organisers are fantastic, and also there's a vibe here that you just don't get anywhere else. So fantastic place to be. I think where we're at is money is constrained. People are looking for cheaper solutions. People are looking also for making their own solutions rather than buying them, because quite frankly, we've reached a point now where that's lower risk than buying a system that's available in the market, but it doesn't quite meet your needs. Because we've been in this situation now for about 4 years, and clinicians have moved on in terms of their expectations. They get better IT at home now through their laptops and browser than they do in the hospitals. I think the same can be said for a lot of businesses, actually. That's where a lot of businesses are at. But we're at the point where NHS IT people and users are beginning to open their eyes to different ways of doing things. So I'm hoping that we've caught the market at the right time, and and the phone's going to be ringing non-stop all next week. It's that message. It's that one there. Thought long and hard about that. It's art. It's not engineering, it's not science. You need a different way to look at developing software, especially new software. Sure, if it's word processing you want, well, the guys down the road will help you with that. But increasingly we need new solutions that involve mobile applications, they involve web technology, and they involve integration with the back office systems or the clinical systems. This is new areas. We're looking for software which fills the cracks in the market at the moment. So that's what I want them to go away with. Software in healthcare needs a new approach, and we need to consider it as art for lots of reasons. Not just because it fits into our way of developing software, which is all about hackdays.